Hi, this is Dr. Artie Kavanaugh, University of California, San Diego, and I'm coming to you on Room Now right before ACR Convergence. I guess that they did have a first session today, but really all the abstracts and a lot of the oral presentations and the lectures and the symposia, all those are coming up in the next few days. So I just thought I'd give you my perspective, having looked through the schedule and looking through the different posters, ton of posters, a little bit down from years past, about 2,000 instead of 3,000. But I thought I'd give you sort of my global thoughts because I really haven't had a chance to talk to any of the poster presenters or ask questions or go to the actual oral sessions themselves. So my my sense of going into the meeting, a couple of big themes that I say. One is COVID. My gosh, there are so many COVID abstracts, and understandably, it's a hot topic. It's the reason why we're having a convergence instead of an actual meeting in an actual meeting hall. But having looked through a lot of the abstracts, it's a topic that I think we still need to learn more about. These abstracts are kind of, I had 20 patients with COVID. I had 50 patients with COVID. The left-handed people stayed in the hospital one day longer. It's a lot of anecdotes, and the plural of anecdote is anecdotes. It's not actually data. So I think this is an important topic, and I think it's one that has certainly resonated with rheumatologists throughout the year. But I think we need maybe to put many of these data together to see if we can make a comprehensive story that is still going to be important to our patients. And next year, I think at the ACR 2021, if it's live or virtual or maybe some sort of hybrid, that we'll be hearing about the vaccine, which I think is also going to be fascinating. I didn't see much about those, of course, because the vaccines are not out yet, but they're going to be out soon, I imagine. And then we're going to see about the immunogenicity and the impact on the clinical outcomes for patients specifically with rheumatic diseases. Another theme that I think we saw a little bit of, but boy, it's really gotten much, much more of artificial intelligence and machine learning. So we're really in the era of big data, certainly as it comes to biomarkers for the prediction of response to therapies in rheumatic diseases, across rheumatic diseases. There's too much information to be able to sort of rationally gain much insight from. Also in imaging, if you think about x-rays, but certainly MRIs, I think these are areas where machine learning is going to have an impact probably relatively soon. There's just so much data available that we can't digest it. We've tried making sense of proteomics and genomics, and now most recently metabolomics. And we try because we want to know at the end of the day what's the right medicine for the right person. So I think we will see more on how do we take advantage of machine learning to be able to do that. And then lastly, the topic I just sort of mentioned, metabolomics. For years before the human genome was sequenced, genetics were going to be the answer. If only we would get everyone's genes sequenced, we would be able to tell who was going to get rheumatoid arthritis and what was the best treatment for them. Of course, that really didn't pan out, and it's probably due to the fact that humans are quite similar at the genetic level. Epigenetics is probably much more important, and that is influenced in turn by some of the other omics, if you will, particularly metabolomics. I know that many of us started our careers in the lab, and of course you're most interested in proteins because those are the important mediators, the chemokines, the cytokines, etc. But lipid-based mediators, which is the essence of metabolomics, are also looking to be very important and may actually give us some better clinical insight into who develops diseases among people who are at similar risk. So as I look going into ACR, I think that those are the things that I want to see. We'll look at some of the COVID abstracts. We'll look at the machine learning, artificial intelligence, and I think all of us will also look at some of the new topics like metabolomics. So it's all about to start. So we're going to get some good rest tonight, and the meeting starts in earnest tomorrow. Keep following it on Room Now.